Okay, it's 9 o'clock now. Munira, we can start.
Good evening, sir.
Kedar,
Good evening, Pramila.
Dr. Kedar,
Kedar
Hello.
and
Dr.
Bhaskar.
Bhaskar is
Hello.
and
Yeah.
Bhaskar is
Bhaskar.
there, ma'am. Yeah.
Yes, yes. Please go
Uh,
ahead now.
okay. Very good evening to one and all. First of all, I know vote of thanks is generally reserved for the end, but I would still like to thank everyone for joining at this time of the day or night, whatever. I think so. Before just to begin, I would like to. I know Dr. Avinash Supe sir doesn't need any introduction, but still, as a formality, I would like to
Oh,
introduce sir.
don't do it. Don't do it. Just don't do
Sir,
it. Okay, fine. It's okay.
sir,
Ours is a small family. We don't need all this.
okay, so I would just like to, anyway, sir, I would still like to welcome Dr. Avinash Supe, sir, for this meeting. And thank you, sir, for agreeing to be present in this session and clear our doubts, whatever we have. So, sir,
Sure.
would you like to share a couple of words on electives, or should we directly start with the questions then?
I can begin for 5 minutes what the whole
Yeah,
concept of elective was. How did it really begin?
sure, sir.
All of you must have what happened actually when the Vision 2015 was developed. One of the lacunae everybody realized was that there is no opening for students to do something for their understanding their future careers, to explore their research kind of a thing, and have an experience of on their own when they want to really go. So there was a lot of discussion on this, and this whole topic of elective was really introduced. And that time it was very sketchy. And then over a period of last 5-7 years, we went through all over the world different kind of patterns which they had. In fact, we had discussions that should we include the professional and personal development also as elective topic. But then there was a lot of discussion, and we restricted to preclinical, paraclinical, and clinical kind of the pattern, which is now in the current booklet. And then that came into GMR, and all of you must have really seen what is in the GMR, that is the document of Gazette. And then followed by, we, I think, had multiple meetings across in our expert group. At that time, we brought out this framework for electives to be there. Now, this is a broad framework where there are only guidelines, but lot of work has to be done by the dean and a committee under him, and local help of curricular and ME unit committees which need to really help them towards development, and individual departments have to really start working on it. And then there are some regulatory things which need to be clarified by the universities and all that. So these what many times people are still not sure about what is going on is because the part which is to be done by the deans and the universities, they need sometimes little clarity of thought. So I think what we will try to do in this particular session is try to clarify doubts, and through which we would say how do we really establish this program over next few years in our country, and let's see how does it really go. And there are some issues, there are some challenges everybody is going to face. So I think what I will do, I'll keep the whole thing open, and if you have any basic questions to final question, just shoot them. And I think we have here Henal is there, Munira is there, Praveen is there. I think we will try to answer all those questions. We have Pankaj also from SRMC, so he will also share what they are doing. Kadu sir is there from university. So we have a very good representation from everyone who will help us to really do this.
Okay. Thank you, sir. There are certain questions which we have already collated, which the fellows have already posted. I
Sure.
will start from them. Yes, sir.
So you want to put in on slide, or you want to just ask?
No, sir. I'll just say the question. Okay. And of course, with as we proceed, some of the queries we'll get in the chat box also. So we will take them up also subsequently. Sure. So, sir, the first question is, what are the differences between value-added courses and electives?
Okay. Now, see, value-added courses is mainly for your development, especially whether it's professional, personal development. Elective is like exploring on your own. You know, it's like, let me tell you, it's a difference between a trek and expedition. when you are going through value-added experience, you are given a skill which is there, which is given to you at that particular time, and it is given to you. And elective is more of a exploratory. He has to experiential and exploratory. He has to go to that department. He has to do that based on project or something like that. So what is important is he not only focuses on something what he has been told, but he also looks around the department. So it's a wider kind of an perspective he gets. Value-added courses, maybe he's learning, say, communication skills or public speaking skills. It's a value-added course, but it is very focused. And he's only going to get that into his thing. Elective is something where he is going to explore the whole thing. Like you are going to elective, say, I'm going to go in some other department. I'm going to see what the department does. There's a lot of lateral learning which is going to happen when you go to electives. So it is not very, it should not be very, though it could have its own learning objectives, but there's a lot of other than learning objectives you are going to learn. That's what is the importance of elective when you're really doing. And it is self-selected. Well, value-added courses, also people select on their own. They also probably do that. But electives is something which people select on that. There's a little difference in these two words. We thought value-added courses can be done during the course through the either foundation course or other time which students have. There they can really develop themselves. Elective is something which is a dedicated time for them, where they have time to explore which they like. I hope I have made myself clear, Bhaskar.
Yes, sir.
No. I think you
Bhaskar, you're muted.
You have to unmute yourself. All of you, have you read AMI guide on electives or no?
Yes, sir.
I think it's
Yes.
fine, sure. There was a very nice AMI guide, and there are so many papers on elective. Elective is a very old concept. I mean, we have just adopted it now, but I think there are, in last 15-20 years, I've seen so many electives coming into countries have really began into that electives. So I personally feel it's an old concept. We only try to put it in our country. So I think we are not used to that kind of training. So we are finding it a little difficult. Yeah.
Sir, the next question is something which I think many of us want to ask. Who decides the topics for electives? Are they predefined, or the institute has liberty or autonomy to decide electives based upon the organizational and local community requirements?
Yeah. Actually, this has been very, we have given sample topics. We have not given, this is not a very prescriptive kind of a topics. The module says something which is sample. I think we have never said that you have to follow them. The institutional committee and the dean along with that should really decide what are the areas in which and up to what depth they are. They are to be decided by the university. And for example, I mean, if you really see, you could have a very broad topic like, say, laboratory experience. I don't think that is something which, or a biochemistry, but you can take a very focused also in that. For example, you want to go to the emergency department could be one of area, or you could say, okay, he would like to handle how an emergency ultrasound is being done in that particular area and fast diagnosis is done, how emergency management is done in laboratory. You could do any other topic, whichever you want to really do it. So it could be very focused or it could be generally broad-based. See, when somebody checks up elective, it is not a broad department. It is a focused area. It could be broad department, but sometimes a broad department could be also too large. So in your emergency department also could be four. So that I think what was expected out of that, see, we have given always examples of block 1 and block 2. We have not said these are the areas which you should use in block 1 and block 2. And it could be, like, for example, I'm posting you in biochemistry. Okay, fine. So you will see overall biochemistry department functioning. But your head has to decide which area you would like to take a project or which area you would like to work. So he might tell you, okay, you work on this particular area. How, like, for example, somebody goes to microbiology. Now he will say, okay, how the RT-PCR is done today. We have been hearing about so much about RT-PCR. We are doing so much about biofiber. So then he could concentrate on how it is being done and what is the way you establish level 3 lab and how it is used into the clinical practice. What are the implications of that in the clinical practice? So he could really do that, and then he can write his reflections about this. In today's world, in pandemic, if you feel these are the important things and I want to understand that, he could just, and then the department has to plan that program in 4 weeks, something like that. First thing is, okay, what are the understanding the principles of biofiber, and then how it is really conducted, that he would explore. Then he would really go and see the clinical impact of those biofiber. Then he would discuss with clinicians and find out whether this has got any impact. So something like that can be easily done, or even say emergency ultrasound. He could really see, okay, how it is done, what is the technique behind this. He would say how he is using emergency, or something like that can be developed. But there has to be a specified plan that we want him to follow the learning objectives. So at the end of 1 year, 1 week, or 1 month, or 4 weeks to be exact, you should have some learning objectives that he should get some idea about it. So that is what we normally mean by an elective. It could be very broad or it could be very narrow or something like that. And see, something like people want to just see how do I somebody wants to just enhance their skills in how do they counseling for patients who are being, say, Alcoholic Anonymous. I'm just giving you an example from psychiatry or somebody. Then you could plan that, okay, how these meetings are conducted, how do de-addiction programs are conducted. You can go and get yourself in de-addiction ward. So it's not necessarily laboratory in preclinical areas, but in clinical setting, it could be just de-addiction kind of center, how the functioning occurs. And then he could even topic he can really take and research. And I think it's not that every time he has to write, he may write just reflections or he may do a research project. Both he can really do. So I think who decides it? The dean has one committee. Committee will identify coordinator from each department, and they would say these are the areas in my department where the electives can be done. And then it is followed by that department discussing amongst themselves and develop some kind of an objective plan when the students come. It should not be considered that the students come, just wander, have a holiday and go back. So I think instead of that, there has a little plan. Of course, he will relax to some degree, but he has to have that some pathway in which he has to walk. It could be a, say, pharmacovigilance program in your own hospital. It could be like that. What are they doing? How they are recording ADRs? What is the impact of that? And how they maintain registries? All this could be part of your elective if you are interested in taking your career further in that. Okay, so does that answer your question that it has to be done by local committee along with the coordinator from each department, and they would like to develop these topics and the areas where you want to really do it. See, currently these are broad things. I mean, today what will happen? There are 600 medical colleges. Some colleges will just allot them 20 students in biochemistry. But actually over a period of time, it should be there that, okay, there are 5 teachers in biochemistry. Each one will have 3 students. Then he will direct them in the areas where they are working. And then he'll give focus topics. And then some of them will try to bring out paper also. So I personally feel it is going to be very variable for us at this stage because there's a different capability and capacity of the colleges. So it's a wide open program currently. We never wanted to be so rigid. Because if you try to give saying that they have to bring out a research project, it will be difficult for 600 colleges and in 92,000 students. Just imagine that. So we have kept it broad and different capabilities of students. So we have to think when you think all these into it. So ideally, yes, I would like students to spend 1 month, bring out some small project, write a report, publish a paper, but it is not feasible in 1 month or something like that. And many of them, there's no capability of doing this. So we need to keep it open. Over a period of time, it will crystallize into something which is more concrete and fruitful.
Okay, sir. Thank you, sir.
Munira, Chetna, Praveen, Henal, anybody wants to add anything, you can please add. You're open for this, okay? Yes.
Okay. Sir, a related question to this. Is there any restriction or recommendation on the number of electives for an institute or for a department also? Like if one
There's no,
department has to...
no. There are no recommendations. Ideally, I would say each faculty should not guide more than 4 to 5 students.
Okay.
That is what is the only suggestion I would give to the people.
Okay.
Because I think, see, everybody has his own responsibilities of education and service and research. So if somebody comes to me like that for a month, I may not be able to guide more than 3 or 4 students at a time. Even if it's a small kind of a project, it takes time. No, I have to spend some time with the students. See, seeing the whole department is fine, but discussing some area, taking their feedback, talking to them, what they have learned every week, at least I should be able to spend half an hour to 1 hour with them. Even if I talk to 15-20 minutes with each student every week, at the end of the week, I should be able to give that much of time there. So I would suggest not more than 3 or 4 or 4 or 5 students per faculty. Now, some departments may be very huge. They can take more students. Some departments may be small. So they may take only 4 or 5 students. See, some colleges where 250 students are there. So in that case, you have, say, clinical, preclinical, or how many departments? Now 8 departments or 6 departments, or there are some associated things. So you will have limitations of students. So I think there you will have to adjust. Clinical departments, you will find little more faculty. So there it could be 3 students or something like that. And preclinical could have been 4 or 5. So there could be some difference. The biggest challenge I see is finding out projects or something for preclinical and paraclinical departments. See, something like 10 people come to physiology or 20 people come to physiology. So what you should really, I said, we had discussion on this, and we said they would do their regular kind of an activities of education and some service, and they could narrate their experience itself, reflect them or narrate them, is something which is also equally good for a kind of an elective. It necessarily may not be every time something which is like, say, has to come out with a research or something like that. I think Ghanekar madam had some question or something like that, which I'm sure you will take on chat box.
Yes, sir. Yes, sir. Actually, so that coming to the allocation of electives now, the question is, what will be the strategy to allot students for electives? Is it allocation by committee or students have the liberty to choose?
I think this is a very interesting question, but you must realize that every college will have its own pathways. If you really see, there are many people have started their ways of really distributing. Ideally, I personally feel we should not do it by randomly, or we should not give it by lottery. That's not what is expected. This is an elective where people have to be given. It could be like a neat choices where they give their 3 choices and allocation committee sees where the choices and allot them based on their either previous ranking or previous marks or their performance or something like that. So you bring in some little component of competition, it always helps. When I was a student, I must tell you, there was a simple thing like a hostel distribution and the room which used to get. And that was based on the marks which you had. I think we had so much of fight for the first and second MBBS marks because our third MBBS room used to depend on that. So it kept ourselves motivated, and then we used to get one of the best room. And I think you should have little that competition of that, and we should respect their first MBBS or second MBBS performances, and we should allocate by asking for their choices and then looking at the thing we should really try to give them, because that is the best way. Just randomly doing it by numbers or lottery is not advocated, because it will kill the whole spirit of electives. Okay?
Okay, sir. Related question. Can a student take a topic of his or her interest, though not specified in the college topic?
Yes, but he will have to talk to the allocation committee and faculty area he wants to do that, or he will have to talk to the faculty of that department. See, the allocation committee may be giving people department. Ultimately, he will discuss with the head of the department or that coordinator of that department. So if he feels that, okay, I want to work on that, and there's a possibility, it should be allowed. I think it's not, they have to just inform the allocation committee and do it. That's all. It is a little flexible model because see, ultimately, if you keep it too rigid, it doesn't work. If you keep it flexible, people should use it, but people should not take extra advantage of this. I mean, I should not do a elective in something like, say, microscopic slide making. That's not a topic. I am worried about that. People will come out with such ideas. I want to do in slide making. I don't think that's not something which is important. Like, say, microscopic, like, say, tuberculosis test or something like that. That's not. Take a little broader. At the same time, there has to be some focus, And that's where allocation committee makes a lot of sense, because there are people who are around, many people. It's not a single person thinking, it's a group thinking. Along with the dean and all, they would probably bring the little more clarity to all this kind of a session.
Sir, like just you said that slide making did not be a good choice.
Slide making means tuberculosis.
Interpretation. Yes, sir.
Interpretation of slide is okay.
Interpretation of that slide can be
I think I understand. You can make it that focus. Okay, how to diagnose tuberculosis, various tests in tuberculosis, that from basic to now the newer techniques, he wants to do it. It's a fairly good for 1 month. See, slide interpretation and making is hardly 1 week's topic.
Right.
How much you are going to really learn about this? No. So it should be something which will fill in for 1 month. No. See, you have to learn also through that. No. For example, giving an example of pharmacovigilance program. This is not taught in your regular curriculum so much. This is something which is very new. People have to be aware of adverse drug reactions, how they are reported, how we normally talk about polypharmacy. This time WHO was medication without harm, how it is implemented. There are so many things which go background which undergraduate student does not know. So I think this is something which I gave you example which could be there, which is enough for a 1 month. So it should be 1 month. It should not be 1 day or 2 day workshops, I think it should be little more broad so that people learn some kind of an value, skills, or some kind of a message, wisdom when they do this. They should be able to reflect or something like that. So a kind of service, issues of service may be better, something like that. That is absolutely fine. We have not opened it for other topics, for example, if nobody wants to look at say something like personal development and professional development of somebody, which it was not, but there are many medical colleges across the world where it considers that. Okay, like somebody wants to just learn some IT thing, they can take it today. IT departments, HMIS, somebody wants to learn about HMIS, how is it implemented, medical records. It can be applied, but that depends upon your college, how you're going to do it. Okay? Somebody wants to do, say, work with artificial intelligence and a new thing. So you can have collaboration with your labs across and find out how it is clinically affecting. You could have been innovative also in all this today. Learning analytics and competence. If somebody wants to work, how the systems work, that could be designed over a period of time. So it's a part of your committee which has to think and do it. But it has to be group thinking at that committee level rather than individual student level or a faculty level. Ultimately, whatever they think, they can think, but ultimately it has to get passed. Why we have kept this kind of a structure? Because people should not take a shortcut and have a holiday. Biggest problem, as somebody said, no, people will take 2 months holiday. So there has to be some structure. When you leave it alone as without doing anything, people will just enjoy their holiday and come back and say, we have done that. Of course, they can do within this structure also. They can make false reports and all that. But the purpose is, this is an opportunity. Students should not lose this opportunity. See, I see many students coming which are so focused, I feel so. See, some of these institutes which I work with, Tata Institute of Social Science, or there is a definite format for this. There's a framework for this. That what were your learning objectives, what are the observations you made, what analysis you made, and then what kind of recommendations you are making. And then the best part is that many of these people have to go back and present. For example, what I would do is, like, for example, you are coordinator of, say, biochemistry department, just to give an example, and you have 10 students who have come. Last day of my elective, I will spend with all of you for a few hours and ask you to present 10 minutes. What did you really learn in that particular thing? That itself will tell me what did you really learn. So you take a good feedback. If you have more time, you will take little more feedback. If there are 3 or 4 students, I'm sure you can spend 1 or 2 hours. Everybody speaks for 15 or 20 minutes on his experience over a month. That would be much richer experience. You can give feedback. Will be peer learning or something like that. So I'm sure it is not prescribed in the booklet, but these are all things which you can easily do in your college. It doesn't require much time. In a 1 month or 1 hour or 2 hour at the end of the elective is worth it. I mean, I think it's worth spent, and we all do it. We enjoy it. And if some students are good, many of them will come out with publications. Afterwards also, they will work on that. They will do projects. They'll do case studies. If the student is capable, he can do many more things. If students just want to pass average, he will just narrate, reflect, present a report, which is also okay along with that. Okay?
Okay, sir. Sir, the next question is, how do we make sure that the students get equal opportunity to select what electives they would like to pursue, as few electives may have more demand than the others?
Yeah, I think this is going to happen because clinical will have no issues because there are so many clinical areas, but everybody wanted something like that. But my worry is, like, say, in NEET PG, do you get the seat which you want every time? NEET UG and PG, you have to get adjusted to other based on your ranking. No, the same thing is here. I think we have to decide. You may increase one place from 4 to 5, that is okay, but don't increase from 4 to 10 to just accommodate students. And if he wants to learn that way, he can always go after elective period also. No, in the evenings he can go, he can learn. So if he's that much dedicated and interested, he can always learn at a later date. Okay. Praveen wants to say something.
Praveen sir had raised his hand.
Sir, this comparison looks good, sir, between NEET PG and electives. But the problem with electives as compared to NEET PG is, in NEET PG, the students can opt to drop out, take a drop for 1 year and attempt the NEET PG again. Here, it will be very costly for the student if the student opts for a dropout in electives, because he will not be able to appear for the exam. So a loss of year will not be really good for them.
Yeah, but see, it's okay. I understand. People are, this is not where he has to do his career. It's only exposure for 1 month. Correct. And if I want to learn something like that, I can always go off my team and work there. No, if I want to learn from psychiatry department, I can go and work in psychiatry department after my evening hours or sometimes in a.
Correct.
See, don't expect all our students have 100% attendance. No.
Correct.
If they want to pursue their culture, they change. I mean, you have 25% attendance anyway. Gap is there, no, which you can always go and work somewhere else where you're interested. See, I was a student, and I remember I must have bunked so many times my gynec internship to do surgery with Dr. Samsi because I was interested in surgery. So I think we all do all these kind of things. Henal has to say something.
Yes, I was going to almost say the similar thing, that this is not such a fixed thing that we have to be so worried about who got what and who got that. People have to get a chance to try out different things. So if your choices were 1, 2, 3 and you got second or third, or you didn't get any and you got the fourth, it's okay. I don't think it's the end of the world. It's just 1 month of exposure. So I don't think we should get so much competition or so much worry about all of these things. The whole purpose is lost if we become more caught up in all of this.
Exactly. I personally feel this is a showcase. So it's kind of a information. I mean, you just have an experience of that particular department. And
the only other worry is, sir, why did we cancel international exchanges? I mean, international electives, because that is no mention of that.
We did not cancel. We wanted to put down everything. But then we thought the MCI in his own style said people will go abroad and have a holiday and come back and all. So I told him that, see, when you go to international people are more strict about their electives. It's not that, in fact, in our country, many times you will find people will have electives, people will go and stay there 1 month. So this whole concept is a little worry, but over a period of time, it will open up. I think in next 4-5 years, I feel we should allow international, if it is a very reputed university or reputed kind of a program where you get a letter and people submit a report and the colleges are ready to invite. Like say, if somebody is getting in Mass Journal from KEM, I have always allowed my students to go there. No, so I think we should allow them. There was little restriction when we used these words. In fact, they were not allowing out of the state also. But we said, no, city has to be allowed and out of the state with permission is to be allowed. So that has been very clearly mentioned. International was discussed, but somewhere or other, the whole board of governors were not in favor of that. So it was really restricted. But I think over a period of time, it will be allowed.
Okay, sir.
Okay. It is just worry. People were worried about, some of the members were worried about that people will take a holiday and opportunity to go to USA for their clinical something and something like that. But I told them today to get an elective at a top university like Harvard is not so easy even for a student. And it requires a lot of your project and they also look at many aspects to go. So it's not so easy to do it. Yes, I think Munira is there and who else is also want to ask a question?
Yeah, Sarojini is there after me.
Yeah.
Sarojini, tell me. Yes, Sarojini.
Sir, about this, what we are talking, doing electives out of our own institute, actually electives is to be done only for during clinical hours periods. The rest of the day, other things are going on. So how the students will cover that part of their teaching?
No. Clinical there are two blocks, block 1 and block 2. In a block 1, the clinical posting continues and rest of the time is spent with the preclinical and paraclinical, their departments. In a clinical posting, there is no, in a clinical block of that electives, there is no clinical posting. He immerses, it's an immersive learning. So he immerses himself into that activities of the department. I think it is very clearly written because there anyway his clinical work is going on. See, the whole idea is that we never wanted to lose clinical experience at the cost of this. I'm sure it could have been changed, but this is what a structure which was formulated because of everybody thought this was a good structure. It can be always argued, in even preclinical, why not allow them to do fully preclinical? But when we talked with people, they said that, sir, if he comes to biochemistry lab, most of the work is finished by 12 o'clock or something like that, or the work he can do it in the evening or something. So there was a lot of discussion on this. And so people said we can have it one way or something like that. So his clinical posting may not be really disturbed for him. And he continues to work with these departments or something like that. If somebody takes a blood bank, then why you lose your clinical posting? Because again, there was a problem about the amount of, if we had to take away this, we had to cut down on some clinical posting. For example, we will have to cut down to 2 weeks from medicine and surgery, which medicine and surgery departments were not willing. We are anyway cutting down to 12 months, 12 weeks. So we wanted to really make that feel. Therefore, those 4 weeks were, it was a big mathematics to really do all this. So that's the reason this approach was taken. Okay.
Okay, sir. Thank you, sir. And when the students are going to other institutes, like the responsibility and all those logistics also will come in picture. That's what I felt.
Yeah, exactly. So if you want to send your student to other student, that doesn't take away the responsibility of the original department or the original committee to completely zero. They also have to look at the report, look at the narrative, have a kind of talk with the student after coming back, see his report. Somebody from the medical college, their own medical college, will have to evaluate them to give them formative passing. No, so they also keep still control over the student. It's only if you have institutes of repute. For example, to give you an example, if today somebody wants to go to, say, spine rehabilitation center, which is a unique, or somebody wants to go to physical medical rehabilitation center, somebody wants to go to neuro rehab center, I think it's a good experience for a medical student to go and spend 1 month and see how the spine paraplegics are being rehabilitated, what is the medical and the scientific basis for their rehabilitation. But then once he goes there beyond the institution, once he comes back, the faculty of your college still should have some control over him, and he should try to see that he gets a proper report, he evaluates, have a discussion with him. So if you are sending your students across to another place, after coming back, there's an always, don't you think, whenever foreign students come to us, don't you think they write a narrative? And when they go back, many times, so those foreign relatives have discussed with me, saying that what did this person learn? Was his experience adequate? So there is some amount of control. We cannot just shade off our responsibility by sending him somewhere and coming back. So that cannot happen. I think that allocation committee has to maintain that kind of an control. Okay.
Yes, sir.
Sir, I had
with respect to that, I was just wondering about the assessment, because that how the assessment will be, and how we say that this is that he passes in that assessment about the electives, because that is
fine. See, you can define a score. You could ask that person who is outside, he to give some marks. You can have an interview, and then, or you could have a Zoom call and make him pass. And ultimately, this is a soft assessment. This is not a very hard assessment. This is a formative soft assessment. So it can be done that way combinedly also.
Sir, I had a question regarding postings or electives out of the institute. So if it's in the city or the state, what kind of paperwork do you think will be required?
If it is within the state and outside the city, local allocation committee will have to make some kind of an MOU or understanding between that institution that there is some going to really take care of your students and have to have a plan, and that should be enough with your local dean and the institution. If it is beyond the state, you have to take MCI's permission, and you have to show them adequately that you have taken all the steps to ensure that the students will look after. There is a coordinator there who will take care of that, and there is a sufficient amount of work which is unique there where the students will be able to go. So if you are able to convince to MCI, they'll allow you. But within the state, it is more of an between your dean and this, and allocation committee has to get satisfied that there's enough amount of say, and the process as well as the assessment plan is there for evaluating such students, and their experiential learning is adequate. So that is the responsibility, according to me, of that your institution, to ensure that his experience is set. Okay. So that is the only thing. See, ultimately, when you're talking about it, everything is not also done for the students themselves, are also responsible. No? They're also interested in doing all this. They also do many times. See, if you look at our own college, Munira, we have so many hundreds of students do, out of 250, I think hundreds do ICMR kind of thing. They do so many papers, publication. Now, you think will happen in every small college? I don't know it will happen. But at least if you have some process where students do something and reflect, I think that's also enough at this stage. Everybody may not bring out paper. At least if you have some plan where I go to experience and I write it back, I think it's more than enough for them. It itself is a process of getting a new experience. No? See, I always feel, as you go across the new organizations or new departments, you refresh yourself. I personally feel you refresh yourself. I think I always feel that whenever I have been to a new department, however, at whatever stage of my life, whenever I have gone to new department in the world or any other place, I always learn something and I come back. Even if I spend 4 days or 5 days in that department, I always learn many new things which I've come back and applied in my own institution. So it may be a focused experience, but there's a lot of lateral learning which happens. Tell me, how many of you must have gone examiners to or faculty to other institutions many times, right? Don't you see many things which you apply, come back and find good practices and all? So it's an indirect learning, and it itself is a beneficial thing to have. No? So I understand there's a plan and assessment. Even if you narrate what are the things which you've seen, which you would like to do, I think that also is enough for this. So there's always lateral learning which happens whenever somebody goes for these electives. See, we all have grown by looking at the world and different organizations, right? You should not remain in one department. I feel you should see around the world and you learn much more around that. That's the way we have learned, all of us, looking at others. So same thing, this is a beginning you are making at a student's level. Okay. Chetna, followed by Neelam, and then Swapnali.
Swapnali.
I wanted fellows also to ask questions. Don't get worried about faculty here. Huh? Yes. Fellows can be very, very straightforward and ask simple questions. No question is a silly question. Remember that.
Couple of logistic questions, sir. 2019 batch, students who have not cleared their second MBBS, they will be offered electives. They are doing their clinical postings.
They should be offered because this time they have made it only 15 days or something like that, right? Or 1 year, one month. I think they have made only 1 month. I think the new directions say. So that should not be a very big thing. They can do during your vacations or something like that. They can do it. That local committee can adjust, I think. See, during COVID, it's all going to be a smaller version of the whole thing. But as over the next 2-3 years, it will get more clarified. So the local committee can take these decisions, I think.
Okay, thank you.
Sampada?
Yes, sir. So there are two questions. One is this year's electives.
Munira said there are no directives available. Yes, there are no directives available because NMC doesn't want to really put. Local committees can take those decisions, I think so. See, there are 600 queries come from 600 colleges.
No, sir, this was about the duration of posting for 2019.
Not come yet, but if it comes, I'll tell you it is like that. I think if it comes like that, but I think if it's 2 months, it's 2 months. There's nothing wrong about it. No, I mean, you can adjust it. 1 month you can adjust during that time and then you can do.
Hello.
But as I said, it's very clearly mentioned that elective should not be used for making up of your clinical postings.
Yeah.
They have to do it separately. That I think is very clearly written. Yes, Vikram. And then
hello. Sir. As MHS is also preparing the guidelines for that about the electives.
Kadu sir, are you speaking?
Yes, sir. Yes, sir. Yes, sir. Yes, sir.
So let their guidelines
sir, don't say me, sir. Sir, please call me Sandeep, sir. Please don't say me, sir. Sir.
Sandeep, tell me, are you preparing guidelines?
MHS the guidelines about. Hello.
Hello. Yes, we can hear you.
Yes, sir. MHS is going to has prepared the guidelines, and after VC Madam's consent, we are going to declare the all about the things, directions about the electives, madam. Sir.
Perfect. I think university will tell you about assessment. It will also tell you about some posting. So it will crystallize more your thoughts and to the local context.
Thank you.
Thank you.
I think here, our Dean Faculty, Dr. Sachin Mumbre, has taken the efforts to make all these things.
Sure. We will await those guidelines and see. I'm sure there are many universities will come and then we'll be able to really see what is the differences. And over years with best practices, they will try to bring together a little more refined documents. No? Sure.
So can we have Neelam, then Swapnali and then Vikram, please?
Yes. And Sampada is also waiting for a long time. Okay, Neelam.
Yes. Good evening, sir. Sir, I have just a small question. Whether these topics that have been given, will they be validated, or that responsibility it lies with the committee or the department itself?
I feeling it should be with department, and coordinator of the department should discuss it with committee, because see, committee again is a broad-based committee. They are not going to go into 250 topics. Ultimately, the topics and this focus area should come out from the departments. And the department is coordinator along with HOD and the senior faculty should try to find out, okay, we are likely to get 25 students. What kind of areas we can really find out, or 2 people in areas or something like that. That I think if the department can sit, I'm sure they'll be able to sort out all these issues.
Okay, sir. Thank you, sir.
Okay.
Yeah.
Sampada?
Yes, sir. So my question is that we have 2 blocks, block 1 and block 2. When we have a medical college of 250 students, can we divide them into 2 groups of 125, 125 and exchange?
Most of the colleges are
all of them
likely
have to
do
go to
that.
block 1 and then block 2 later on.
Most of the colleges will do this. They will change. Yes, and that is what they should do, because otherwise it will be too crowded.
Yeah.
Most
And
of the colleges are
secondly,
doing it. Whatever I have discussed with CMC, Ludhiana, Vellore, other MIG colleges, I think they are likely to do this, and it should be okay. I don't think, as far as possible. And I think Sandeep, MUHS also can bring out these kind of suggestions. These are recommendations or something like that. So I think it should be okay. As far as possible, those 2 blocks are made with those guidelines. I think it's okay whether they do this first or second. It doesn't matter much.
And sir, topics with humanities, you said that personal development is not being included, but topics with humanities can be included, and if so, in which block?
Which one? It depends upon what kind of humanities you are looking for. If you want to include them into preclinical, paraclinical and other topics, you can do that. But as I said, currently we have not included professional and personal development of a person. Like say, if somebody wants to do singing, I think this not been included, or voice. But I think those institutions which has a communication lab, they can go and attend elective into communication lab, and they can learn about communication skills itself can be done. But we had initially had restrictions about it because there were not many who are there. But if the committee, local committee feels it, they can do it that way.
Yeah. Okay. Thank you, sir.
Sir, in continuation to what Sampada has asked, if we are going to divide them into 2 batches for block 1 and block 2, and as you had said earlier that in block 2 there will be no clinical postings, but the students who are going for block 1 will have clinical postings. So sir, at any point of time there will be clinical postings going on simultaneously for block
okay. Difference it makes. The departments are separate, no?
Yes, sir. But then the faculty who are going to be preceptors in the clinical departments, they will have both the things, simultaneous students also, as well as these additional students of electives.
Yes, some of them will have that. So they will have to really adjust it that way. See, if your unit has only 4 extra students, it doesn't make much of difference. No? See, you have clinically, remember that, your unit, you already have, say, 12 students and 3 or 4 add to you. Doesn't make much of, you only have to talk to them differently, I think so. And see, mainly the areas which will be super specialties, other areas where there may not be students at all. See, very few students are going to take general surgery as their elective or general gynec as an elective. They will take some focused elective.
Okay.
So even if there are 3 or 4 students extra, it is not going to matter much. And plus they will have their own, like in your own unit, don't you think there are students at different levels?
Yes,
in my own unit, you used to get electives from all over the world, and from all other medical colleges they come. So we treat them differently. No, we still have our regular batch also continuing. We also take care of electives. Postgraduates come from somewhere, then undergraduates. So we have so many levels of students working at the same time. It doesn't matter. I think we have all been able to handle all this very easily. It's not something which is very difficult. No? Okay.
Okay, sir. Thank you.
Yes. I think Swapnali wanted to ask anything. Are you still there, Swapnali?
Yes, sir. Yes, sir. Good evening, sir. Yeah, sir. I hope I'm audible, sir.
Yes, yes.
Yeah. So I wanted to ask you, sir, that okay, that all we are doing electives, but if we see the recent trends among the students, they have been going for the international exchanges under the MSI, that is the International Student Association. So with that International Student Association, that's a very huge trend since last few years, and most of the students who are opting for a MLE are going for the, or any of the, where they are planning to, when they have a plan of going out, they are planning for electives. They ask for a 1 month off or 1 month of this thing. So those electives, what shall we do? Because those electives and these electives are
your
going
point is very well taken. Let the student organizations write it to NMC and let NMC sanction and develop a kind of a guidelines for international kind of a student electives, and it will solve the problem.
Okay, sir. So that was always my worrying point, because 1 month that plus 1 month or 2 months this, then students will miss quite a bit.
Sure. So what they can really do, you can have NMC can pass their electives and all. See, currently we still are not in that credit-based system, which dental or the UGC in National Education Policy 2020 has really established. So if they develop a credit system and then electives get credits, whether international or national or state or whatever, and if it is added to your credit, then it doesn't matter. Then it becomes part of your credit system.
Yes.
But currently we are not in that assessment format. So we are looking at a format which is where we want them to go through this experience. But as you said, international was not permitted. But if the students write it down to the Board of Governors and Board of Governors develop, or these NMC new kind of boards, if they develop, UG board develop guidelines and they send, okay, in these circumstances, they can do a student selective and they will get the same amount of credit, or it will be considered as their attendance. I think it is your job is over. Then there is no duplication.
Yes, so in this context, I need to I wish to ask you one more question, sir. In this scenario, in such scenarios, we need to take a prior permission for from the NMC.
Even you have to go beyond the state. Yes, if you have to send the student outside the state, you have to take a permission.
Yes,
I think that is very clearly mentioned into the elective. I think elective modules.
Yes. Sir, one more thing. In such scenarios, what means I had tried this during my since last few recently I have been talking to the students that what can we do about it. So in that one more thing which I have realized that I had, because they arrange the camps and they do quite a few more activities under the MSI. So in that particular thing, I was talking to them that can we have a collaborations, because we are looking for so many collaborations and so many things which we are looking forward for our institute. Means any institute should look forward. So MSI does not want to do a collaboration. They have their own this thing. In such scenarios, if they are not willing to do a collaboration, can we still send them with the NMC permission, because they just take a one single permission from us? Okay, that we want to go and then kindly allow us.
Swapnali, these are the things which students do it at their own level with permission, and they probably, there is no formal kind of an permission for this at this stage from NMC or MCI. These are done at an individual students level. Like say we used to have a program with the Mass General or Harvard. So our students used to go in vacation or used to take their own leave and go. Now, if you want to get a credit for that and it to be included into your MBBS curriculum, we need to bring that system through NMC, which has not happened.
Yes.
So it will take some time before it will happen. We are not still open that way. Ideally, we should be open, but we are not in that phase of openness because of we always worry about people misusing this facility.
Agree.
Rather than using that facility. You understand my point?
Yes. See, absolutely.
Because of our past experiences, like people bring wrong certificates and have holidays, people still don't want to open it that much. So they still want to keep it closed. But if credit-based system comes and they ensure that these are okay, then they'll allow it. Maybe it's a question of time this will open up actually.
Okay, sir. In such scenarios, but the attendance can be given to students or should not be allowed? It should be with their own use, right?
Currently it is not given. Okay. Currently it is at the cost of their own attendance. Yes, I think Rohini and Santosh, both of them had some questions.
Thank you, sir. Thank you so much.
And Guga had some comment, which we'll ask her to speak later. Rohini, you want to ask some question?
Yeah, yes, sir. Yes, sir. I wanted to ask about this credit system, but you have said that is not there this year. It's not yet opened up by NMC.
See, we did not adopt that, but National Education Policy 2020, which has said credit-based system of UGC and all that NEP, which I think dental people are trying to apply, but I don't know how it will act. We are still working on that, but if it comes to, then it will come. That time we can give credit for this particular system. But it is still, I think we have a long way to go. People are not, if I bring that till 200 more questions and people will be more confused. So let's first establish this system and then we will shift over to other system.
Yes, that's
okay.
And so there are one very specific, it was like in the in the modules that they have given community medicine in block 1 and block 2. So we can use that for both blocks. No?
Yeah, both blocks. In fact, we wanted We have kept it in both blocks only because we wanted to people do community-based training.
Yeah.
Electives.
So that is it. Thank you, sir.
So opportunities basically. Santosh? Santosh, are you there? I think we have lost him. Guga, are you there? Guga Priya?
Yes, sir.
Okay. Santosh, are you there or you are?
Yeah, sir. I'm very. Can you hear me?
Yes, we can hear you now well.
So see, what Swapnali was saying, actually that international thing can be any time in the course of MBBS career. What NMC has said categorically is beginning of 4th professional year. And that is on a fixed timings where entire student batch of that particular thing will be doing the elective. So international, whatever the students want to go anywhere for their personal development is completely different, and we should not get confused that with the electives of NMC. And NMC has given it very beautifully and very clearly. Just to share example of our college only with 250 students, we have proposed to divide this into 125 because that's the feasibility. With that, our number of subtopics automatically decreased to 50%. And that is what should be taken by colleges with 250 students. That's why my 2 comments, sir. Thank you.
Sure. Thank you. I think that's very important comment. Guga Priya, you want to say something and then we'll go to Rakhi.
Sir, I have just a question. Can electives be offered in medical education?
I think AIMS with his all autonomy can do it. The NMC has not put that subject, but of course they can do it. I think there is nothing wrong. It's a college, but currently clinical and preclinical, you can add in preclinical if you want to add it, or even clinical education can be added if somebody wants to concentrate that. It can be done, but if, as I said, somebody has a communication lab or something, currently it is not put as formally, but a local committee can do it, and AIMS can definitely do it.
Yes, sir. Thank you, sir.
Rakhi?
Yes, sir. Yes, sir. Good evening, sir. Sir, I just wanted to have this, whether you can offer electives for, physiotherapy, occupational therapy, all these other paraclinical branches which are important in clinical management.
Yes,
like there are institutes which have audio speech therapy.
Of course. It can be done. Definitely it can be done.
Okay. No, sir, because we are thinking of all options of 250 students. So that is why
in fact, I thought if you see the world, somebody will have a elective in, say, cochlear implant program. Why only audio therapy? It could be a very specific program also where you could just go and see how it is done.
Okay, sir. Okay.
Definitely. Paramedical, though, definitely. No, why not? I mean, that is absolutely no issues at all about it.
Okay, so that means, sir, we can collaborate with whatever physiotherapy, occupational therapy, ask their HOD's permission whether they could take our 3rd MBBS this way under elective, and accordingly, just as you're suggesting, to have all those programs in place, the learning objectives and 1-month program. Okay.
Sure. See, thank you. Pankaj, you have said yoga also. Is SRMC going in yoga? Elective in yoga? You're on mute.
No, sir.
Huh? Pankaj, I can't hear you.
Hello?
No, tell me.
No. Hello?
Pankaj, speak, huh?
Sir, I was suggesting for the internship. CRMI officially notification is on yoga is there, sir.
But is there a yoga in your institution or outside?
No, actually in our institution, we have a mind body medicine department which takes care of yoga and other things, sir. We have a special department under allied health sciences.
If you have a department within even city and all, you can have a tie-up and you can send people for yoga and you can ask people to listen to about health effects of yoga and all. No issues.
Yes, sir.
Have a proper tie-up. If
yes,
your own college department is there, no issue at all. But if you don't have, then outside you will have to have a tie-up and all that kind of thing.
Yes, sir. And sir, one more thing, if I can just take a lead here, sir, there was one question with respect to community medicine in two blocks, block 1 and block 2. And being a professional in community medicine, I have slight reservation. I may be wrong. You can guide me. I'll be happy if the student do not join community medicine in both the blocks, because the purpose of elective is to give a wide horizon to various electives rather than restricting to one close subject oriented to specialized thing. That's my personal
Not
opinion.
that way.
Not to
Not that
encourage
way.
them to do. Yes, sir.
No, not that way. See, the idea is when somebody is going, it is an exploratory, but also it is something where they helps you to select their career also, no? Now, if somebody wants to do community medicine and he wants to go to some NGO or he wants to do something and see how these health projects are conducted in the community, or how somebody is going to implement this particular program, malaria program or something like dengue program or TB program, I think it's fair enough. Let him spend 1 month with people of how the national TB program is implemented in our city of Mumbai. I think it itself is an experience. How many of all our faculty and students know about the implementation of National Tuberculosis Program by the government and corporation in city of Mumbai? Hardly people know about it.
Yes, sir.
So if somebody wants to explore it and want to find out and test himself how it is done, it is absolutely fine. It's still a clinical field. It's still a community-based project. If you want to really see how you attract people, how you ensure that people taking treatment, what are the various techniques they use of community practice, community communication, which is absolutely fine. He's learning something. No, you have a learning objectives for him. So, in fact, we are creating
Thank you, sir.
not a super specialist. We are creating a good
basic
Indian doctor, no? Basic doctor, no? I think.
Yes, sir.
Okay. I hope I made myself very clear.
Yes, sir.
Chinmay is there.
Thank you, sir.
Chinmay and Vatsala.
Sir, if we look at the word elective, those students who are going for USMLE and PLEB, they are running for the electives in few of the institutions. So I just want to know what difference they have than our electives, which we have started, that the students are running for that electives, and here we are struggling to just impart the electives.
The problem is there, if you have an elective, you get preference in various postings and selection of various residencies. Because if somebody has done an elective in USA, the resident director, see, imagine there is a resident director who selects people across the world. Now, if somebody has done an elective, then he's used to the whole system, you know, talking about the system-based approach. So if somebody has seen the system, he's always prefer that. So if I know that this fellow, he's not absolutely going to be raw when he comes to. So and he knows about the system, how the things are done in USA. He is capable of handling all this. Then that director will have more faith. And that's what they look for, that, you know, something like that. See, you are not understanding the situation in USA. In a USA, to get a residency, there are 1,500 or 2,000 applications in each department, and they have to select 20 people. So they are going taking interviews. So they are looking for people who will be more compatible. So they look for people who have written publications, who have looked for electives, those who have worked there, those who are from the reputed college. So these are kind of added kind of things which students want to do so that they get here. In our place, we have not kept it optional yet. We could have kept it optional, but then if you keep it optional, the whole purpose is lost. So, so that's the reason we have kept it for everyone. But I think those who want to do it well will do it well. Some of them will do it, and that is there everywhere. No, I mean, some of them will just want to go through this and may not learn. Abhi, it's like you can take, I'm not saying you can make somebody do elective, but how much he learns from that is very difficult to really appreciate. Yes, Vatsala.
Okay. Yes, sir.
Vatsala is there?
Yes, sir. Yes, sir. Sorry.
Tell me.
Sir, I just some time back we talked on yoga. Actually, just to tell you is that I selected elective as yoga only when I had to present in this elective group. And that was because yoga meaning, actually scientifically if I have to speak, it is more of ergonomics. because this is very required in a dental profession. You know, most people of us, all of us suffer with cervical spondylitis and lumbar area problems. And over a period of time, it becomes more difficult for us. So if the children are taught these things earlier in and as to what posture they should have and what, according to that, meaning these aspects, even the DCI president came up with that. So am I
very right you are. Absolutely right. I tell you, I suffered from laparoscopic shoulder in 2007. And I had a bad shoulder. I could not operate for a few months. And then I realized it was all about ergonomics. So then I did a lot of research on ergonomics, and then I published papers on ergonomics. And then I realized the yoga is very important. So when we formulated this program in 2011, we wrote 25 hours, yoga as well as sports.
Okay.
And I remember in 2012, there was a news in Times of India which says medical students are now going to play with mat and bat, you know, and there was so much of uproar into the MCI saying that how have you included yoga and cricket and sports and all that kind of thing. But fortunately, Prime Minister Modi ji came and he started the yoga for whole country. And then they said, no, now you have to include that into the curriculum. So what was deducted was again put it out. So there's a different aspect to this. But what you're saying is a lot of sense. But what I feel, it should not be yoga classes. It should be medical, scientific principles related to yoga. This could be your elective rather than just attending
That's what
yoga
I thought.
sessions.
That's what I thought. The word I have just not taken the right word, I felt, though it is very easily understood by the students at their level. But we want to apply something more to yoga. Yoga with the point of dental ergonomics. But one more
so
thing,
if you understand, ergonomics and you work towards that, then this is a extremely fruitful experience and it's useful for you, no?
Yes,
People don't realize the value of this. Okay.
Yeah. And one more thing, sir, I wanted a clarification is that in this, we had a principal perceptor and external perceptors and all. Well, as dental, I can understand since we are doing the elective, we will be there. But can we rope in the Department of Physiotherapy from the medical college, or we are not allowed?
That is between your director.
In collaboration.
Your director has to give order to the Nair Department of Physiotherapy. That's all I feel. So.
Okay, with
it's
that,
local
it's feasible. No, it's not wrong when we do that.
Oh, of course. In MCG,
and the Yoga Institute also. Yoga Institute also will have, because someone who knows the thing has to teach. Not that I
think even our college also had a yoga teacher, and we had a formal MOU with yoga institutes and all. So if it is that way, it doesn't matter. It has to be formal.
Okay. Thank you, sir. Thank you so much.
So who else has any questions? Bhaskar, are you there still or you're left?
No, sir. I'm here only.
So tell me, any other question?
Yes, sir.
Sir, in chat box, there is a question. In chat box.
Yes, sir. Yes, sir. There is one question. Can we provide a certificate on completion of the elective?
You can do that. People will preserve it. It will be little more of an, some kind of a festival kind of thing. I have a certificate and also let it have. There's nothing. You give value to it, no?
Okay.
Absolutely fine. At a local level, you can do it. There's nothing wrong about it.
Okay.
It may not have much value in terms of his achievements, but it will have a local value. Something like local ceremonial value, no? It can create. You can create it.
Sir, there are other questions also, but most of them we have covered regarding the strategy for allocation of electives. Then regarding the electives for batch passing third, first this year. So most of them we have covered.
Sure. I think one point which we have not covered is assessing it. So we have kept it in a formative assessment and not as a formal assessment. And it has to be included formative and it's a soft assessment. We have not included into certifiable kind of a thing because we thought it would be very difficult and we are doing this experiment. So we should keep it as a formative assessment and people should value that way. And I think university may probably give us better guidelines on this over a period of time. Okay.
Okay, sir.
Oh, sir, can I speak?
Yeah,
Swapnali here.
Speak.
Sir, I want to ask you, then can we have, when we are talking about a collaboration, then can we have a collaborations with a district, similar to the district residency program into the PG, a collaboration with to the health system, means a district health system, and then they can be the part of the rural implementations or a service,
Yeah,
because
yes, of course. This is, you don't look at service component here because they are students.
Yeah,
exactly. You are looking for the educational component, and that with a digital like community-based projects, everything comes under that, no?
And means I feel that if we can just incorporate a reflections after every, if it is of a 1 month, after 15 days or after a month.
Swapnali, there are so many institutions in India, like say Wardha, CMC Vellore. They send their students 1 month for place like villages and make them stay there, no? There are so many programs in Nepal, Patan, who go there and stay there 1 month. So it's a just way of building a program and let them take with some focus and learning objectives, and they can come back. All this comes under community-based projects, no?
Yes, but if we are doing that, do we authenticate or validate such programs from NMC? Do we need to do that?
No, it's within your state. You don't have to do it. It's a local thing.
So within the state, we can take the local authority.
That's what that block makes it very clear, no?
Okay, sir. Yeah.
So if we want to go outside the state, NMC permission is required.
Yes, sir.
See, if you want to do in a Thana district, you don't require any permission.
Thanks, sir.
Okay.
So you are answering all our questions so patiently.
Yeah, no problem, beta. I understand. I think Rashmi has joined. Rashmi, you want to answer ask any questions?
Hello, sir. Sorry,
Yes,
I
Rashmi.
missed it. I totally forgot about it.
It's okay. It's not something. This is just questions and answers and queries and sharing practices. What are you doing, Chetna, at your college?
Sir, what we are doing is we are allowing students 10 preferences to select.
So 3 to 10.
We created an e-booklet, and each of these electives we have written a small brief write-up of what the elective is about, what are its aims and objectives. We circulated that by WhatsApp, and over the next week we'll be making 10 preferences, and then we will give it according to the preferences. If there is a tie, we will consider their university marks for selection in case there is a tie. That is how
very good. That's very nice. I think that is something which is good. People have, I'm sure there will be wonderful ideas at the end of first year, and they will be able to share our best practices and come to some kind of an good conclusion, you know. See, I understand everybody is little worried because this is the first time and there's a logistics issues and guideline issue. But remember, as we go on walking in this path for next 5 years, we will have much better experience and more finesse in doing all these things. And I think ultimately we have to look at the goal with which we are doing it. We are not doing it for just doing an activity. We have some goal for students to learn, and students themselves will go on demanding all this, I must tell you. Because this is an immersive experience.
Many of the colleges we should have done, I think some of us have done already, we haven't done it, is we should have asked the students what are their choices before we started framing the electives.
Maybe next time we can do that.
Yeah, next time we can do it. CMC, Ludhiana and some such colleges have done that. They ask the students what do they want to learn. Then they have done it.
See, when you say students, see, many times you find that we are top heavy. The teachers decide what students have to learn. But see, it's actually, you know, this is where I was always taught by Dr. Dhanuka, that how do you ask your child to decide his career? Either parents decide or the child decides. Each child mature enough to understand what career I should do. Many times he's not there. So the best is let students put their choices, and teachers have to guide them by holding their hand and give them those experiences. So I think this principle works everywhere in your life. I think so. You know, Anyway, somebody had a hand raised. I think Pramila, you want to say something?
Yes, sir. Sir, I have planned elective for genetics because under MUHS, when we were running courses of certificate, we found that many students who wanted to go abroad, they wanted to do something in genetics.
Fine. Genetics is a good topic. It's a good field.
Yeah.
In fact, it's upcoming field, and people want to explore new genetic tests, how they do it, how genetics is involved in every disease kind of thing, chronic disease. I think this is a whole world. I think somebody wants to get glimpse of it within a month. I think it is still wonderful experience, I would.
Yes, something like electives, elective short duration in PCR or cytogenetics or counseling. And then if they want to do value-added course, certification or fellowship can be further. That is already depending on the duration. That's what I thought I will plan for.
Sure.
Okay.
Sure.
Thank you, sir. Thank you.
Definitely. Genetics, anyway, we had included in our booklet also because we thought this is a hot topic. Yes. Sharmishta, you want to ask anything?
Hello, sir. I'm back after many years.
Yeah, so you want to ask anything?
No, I'm just getting into the system now. I'm yet to get into the system. We did electives in Malaysia, but that was in a different way. So I'm just learning from all of you that how exactly to go about as per NMC guidelines.
Okay.
So probably next year I'll be doing my opinions or my recommendations or whatever.
Sure. Definitely.
Yeah. Thank you.
Okay.
Thank you
so anybody else has any questions? I really appreciate your enthusiasm from 9 to 10.
Sir,
yes.
Chinmay here. Yeah, Chinmay here.
Yes.
Sir, I was just thinking that can we have a repository of different elective plans from different institutions? Because sometimes it happens.
People are ready to share. If people are ready to share, yes. But see, question is repository is one aspect which will ultimately anyway happen. But availability of resource person, time, the kind of services, infrastructure is another issue. So you can get ideas by repository. Ultimately, local committee will only have to develop and objectives and availability and affordability and the accessibility, how many number of students, motivation. There are so many factors. And ultimately,
and expertise.
See, today we are going for the first. Then, see, next year you will have automatically choices. Students will say, no, this was a good experience. This teacher is good. Here the topic is good, but the teacher is bad. So they will not go there. Automatically, there will be changes. Students are more smart than all of you. Next year, third year, they will automatically have whole data in your college. You will come to know where the electives are looked after and where they are not looked after. They are very smart. They will have their own networks. Like we are having this meeting of faculty. There must be many Zoom meetings of students must have already occurred.
Yes, sir. And I think
don't consider students to be fools. They are much smarter than you.
They have more exposure, sir. We never had this much of exposure.
Okay. Yes.
They have more exposure. They know much more. And it's a very good idea to ask the students to be partners in decision, in planning.
Sure. Definitely. Yes. So if you have anybody else has more questions? Anita, you want to say anything about biochemistry? What have you planned in your thing? Kavita is there?
Yes, sir. In biochemistry, as per the in the last meeting which held regarding electives, they have told that we will get 20 students in the lot of 10 students in first month and 10 students in the second month. So we have made 2 modules right now for 5 students each. And module 1 is on error management in clinical laboratory. And second module we have made is on interpretation of laboratory reports. And we are yes, sir. And we are also ready with a few more ideas like quality control in clinical laboratory. But I thought that quality control will be a little more for undergraduate students, but we can anyways think of it later. But right now we have prepared. We are ready with 2 modules.
Do we have electives on something like clinical nutrition? All these are very interesting.
Yes, sir. Yes, sir. That is also there.
Where you can make it, because these are not taught so well into our curriculum and we don't focus them so much. So I think these are something which you can push more,
Yes, sir. That is also there in the
So you are anyway ready according to me. Good. Kavita.
Hello, sir. Yes. I have prepared a elective. I am the preceptor of one. Like we are going to do it in HIV, and they are going to see how the ART center works, how the counseling is done, post-exposure prophylaxis, and how to counsel, because post-exposure blood needle stick injury is a major part of what we do over there, because the entire hospital people come there. So how do we actually, as everybody knows that the NACO is the one of the best and successful public health program which has been run. So how the ART center works, so that is the elective we have planned, and we have planned like them to have choose one interesting case, and at the end of the posting to present that interesting case, because there are a lot of interesting scenarios which are there. So this is what we have planned for our elective. And as in Department of Medicine, we have, as you have already said, that there are a lot of super specialty, but some super specialties have not actually gone into departments or something. So we have electives in rheumatology, we have electives
specific OPDs,
pediatric, which is very upcoming branch. So those are the things we have planned in our department.
Sure, perfect. I think you have got all a feel what questions are there, what we can really do. Somebody has one last question we will take. Somebody has raised a hand. I think, who is there? Sanjeevani?
Sarojini, sir. Sir, actually, this is a logistic question, not a question, it's a comment. Sir, I work at Aurangabad and I'm connected to a lot of interior medical colleges. What I have realized that implementation of CBME has not been very effective. And the approach of many of the colleges in the interior towards elective is very negative. And as we have one representative from MHS, I thought I should make this comment. So, and even only 2 CISPs have been occurring in all of the institutes. The CISPs are not occurred, and all the CISPs were done mainly for the first MBBS to phase 1 and phase 2 teachers. So what has happened is that there is so much of a clarity is not there. So I thought something should be done for this.
No, what has happened because of the COVID, many times people did not, government colleges many times did not put so much of effort into implementation of the curriculum, in some peripheral places where the shortages were there. But remember, I always feel, it's like a laparoscopy. When laparoscopy came, there were so many people who were opposing laparoscopy. They were saying, what is in laparoscopy? We should not do it. In fact, in hospital like KEM, there were 6 units and 5 units refused to do laparoscopy. And my unit was the only unit which used to do laparoscopy. And this was in 1990. And today you find we have completely shifted over laparoscopy. Now, I think initial reaction people will have comments, but Sarojini, don't bother about it. I think we should try to reach as much as possible. University make efforts, regional centers are making efforts, national nodal centers are making efforts. Slowly the momentum will come when students will demand, and you will have to go and work on this. See, faculty can comment like this for some time, it's okay. But ultimately students will find electives useful. They will start coming and demanding you. The colleges will have to change it. And yes, sir, ultimately the change comes that way. See, now if I go, and I have been actually moving around all over India, and I realize most of the good colleges, the students are asking for a change. Government colleges, we can suppress students. In private colleges, we cannot do it. But the change comes from there over a period of time. And over a period of time, students will ask and it will come. So don't get so fluttered by or frustrated by this. It's a question of a large system where we are looking for a change. I think it's okay. I think these are slow changes. Curricular changes don't happen in 1 day or 2 days. It takes years to make a change. So we should be patient about all this.
Yes, okay? Sir, I just wanted to bring this to the notice so that something can be done at MHS level, and even means like there are so many faculties here. So
Sandeep, you have to take a note of this.
No, sir, CISPs need to be done because the things are very blurred in the minds of many clinicians. Sure. I would say actually phase 1, phase 2 teachers. They have learned better.
Definitely, I will take this.
I think Pankaj and Praveen will say they are ready to take third CISP, but I think, the whole idea is that it's a lot of effort by the nodal and regional centers to do CISP. No, it's not a simple thing what you say. People have worked hard on CISP.
Actually, sir, we are in favor of
it can be taken at a college level. We have faculties.
For part 2 things, we should have it.
Okay. We will tell NMC to start CISP 3. But remember, ultimately, see, we can create things. Ultimately, every individual or the colleges have to take it on their own. No? Ultimately, your ranking will come down if you don't take it. Education is all about quality. So if you want to run an education institute without quality, that's okay. If you want to bring the quality, then you have to take effort.
Sir, we are ready to take at college level. We are ready to take at college level, sir. We have faculties, but we are not getting permission from NMC. That is a big problem.
Okay. That can be told to the universities and NMC.
Sir, madam is correct. Because there is no charge for our regional center. That's why some infrastructure as well as resource problems are there. But my Honorable VC Madam has taken it, and now she has appointed 3 persons for the regional center, and now regularly RBCW and other programs will go on.
Sure. I think you have a solution here, Sarojini.
Thank you, sir. Thank you, Gadu, sir.
Yes. Yes, ma'am. Thank you.
I think there are not many more questions. We can close this, and I really appreciate all of you to stay from 9 to 10:30, which is a good amount of time. I appreciate your patience and enthusiasm, and I really feel that if people like you are there, any program will be of a great success. Thank you so much. Sure.
Actually, sir, we are very, we appreciate your talking since last 1.5 hours, and very patiently telling the solution as well as the answers of each question. Really, you are great, sir.
Sure. Chalo, take care. Bye bye. Okay.
Thank you, sir.
Thank you, sir.
Thank you so much.
Thank you, sir.
Okay.
Thank you, everyone, for joining in the meeting.
Thank you.
On behalf of the GSMC FEMA family, I really appreciate and thank you, sir, and the faculty members, and of course the GSMC regional family to provide us this logistic platform so that we could interact with each other. Thank you so much.
Thank you. Bye.
Yeah, thank you. Thank you, sir.
Yeah, thank you, sir. Bye.
Thank you all.
Thank you all.
Thank you.